And I want to talk about some management strategies and intervention that we consider within our practice and some future direction of where we're headed. So, this laundry list is really a complication list that we see in head and neck services that reach to patients that have had an impact in oral continuity. And many times that can be through iodine treatment, and it can also be that which occurs with a course of external beam radiation treatment that includes major salivary glands and also surgical intervention. And so we have a commonality of many of our patients that go through such treatment, and many of those will suffer with common issues with burning mouth and having a higher incidence of breakdown of teeth and having sensitivity of the teeth and more difficulty on swallowing and the higher propensity of developing an oral infection. And one of the areas that seem to cross over between many of the solid tumors of the head and neck for oral complication rates when radiation is involved is a drier mouth, which we're going to classify as xerostomia, and silodenitis, that is an inflammation of the salivary glands. And I'm not going to be able to get through all these complications, and that really wasn't the scope of today's conversation. But I do want to share a little of what we know about with salivary dysfunction. So I think it's always good to start by saying what is the foundation of our knowledge as to radioactive iodine. And we know that there are long-term side effects of radioactive iodine treatment in thyroid cancer survivors, many of whom are on this call today, that can include damage to the major and minor salivary glands. And even at doses of 100 to 150 millicurie, you can cause a salivary gland disruption in a substantial number of patients. And its impact then can have a downstream effect, particularly in comfort of the mouth, in cavities developing, sensitivity and pain of the oral structures, as well as taste and swallowing and other. So what I want to share a little today is what are some of the symptoms that occur when either an individual goes through an iodine 131 treatment and or a radiation therapy that's external beam. And symptoms are going to always be principally centered around inflammation and changes to circulation and the xerostomia and pain or swelling in the glands, again, that we call silodenitis, and taste acuity changes. And what we hope to discuss over these next few slides is that impact of what will occur thereafter. So we have been interested in this topic for many years, and several years past, we started research in what actually occurs when an individual has a drying impact in the mouth, and that a patient soon thereafter starts to complain of changes in the comfort of the mouth, whether it be sensitivity to hot and cold of the teeth, or periodontal disease, or oral infection. And what we found many years ago, even before we coined the term microbiome, we found that there was a substantial increase in a substantial number of patients that had radioactive iodine therapy with a microbe known as Streptococcus mutans. And the Streptococcus mutans is a most challenging organism that has quite evil consequences to dentition when it is at a high volume in the microbiome. And so even with our early research, when I was young in my practice at MD Anderson, I've been at Anderson close to 30 years. And one of the things that really happened substantially was our interest in bacteria that could lead to consequences in the oral cavity and the entire digestive tract. So we investigated patients in this very first study, particularly with oral consequences from iodine 131 for patients that had had treatment even up to 20 years prior with iodine 131 treatment. And principally what was found was that there was, with this group of patients, even a smaller population, it showed that with stimulated and unstimulated salivary collection, that there was most certainly a change in output. And output, the higher the millicuries used in radioactive iodine treatment, it was in parallel with the complication rate in the oral cavity. And also patients advancing in periodontal compromise. So more challenges with bone loss and gingival recession and gingivitis. And this was quite substantial because this group of patients did range from having had iodine treatment only a few months to those that had been close to 20 years out. And so it showed gradual reduction in various time points when patients were having salivary collection. In addition, it showed as salivary output decreased, the Streptococcus mutans actually increased, which again is one of the more virulent organisms that can lead to cavities and to sensitivity and breakdown of the teeth. So that's extremely important. And this study, again, was launched in the 90s and has stayed the course with regards to the data, having very similar results, even in our more recent trials. So as we have advanced in knowledge and have also assessed patients what I'll call longitudinally, so long-term, when you look at the impact of radioactive iodine in patients with differentiated thyroid disease, and you look at a very awesome test for salivary function that we call scintigraphy, you can find that overall patients can certainly see changes in the impact of the overall salivary function. So this particular study that I'm going to present is looking at about 213 subjects where 852 salivary glands of those subjects were assessed at various time points. And one of the commonalities of many of these patients was inflammation of the salivary gland tissue, particularly the parotid and the submandibular beds. And this was a swelling that is what we call a chronic silodinitis. And again, it's a chronic complication that many of you in the audience, I'm sure, have suffered in varying levels. And in this trial, to evaluate the long-term effects of radioactive iodine ablation on salivary gland function, the scintigraphy, this marker assessment of functioning glandular activity, was assessed by a comparison of two of the salivary gland scintigraphies that were taken before the radioactive iodine ablation and then 5 years thereafter. And what this showed was that the overall salivary gland scintigraphies, its output, was performed again before the ablation, 5 years after the ablation, in these 213 subjects who also underwent a thyroidectomy for thyroid cancer. And the uptake scores of the radioactive iodine and its consequence with salivary function was analyzed. And changes in salivary gland function were then graded as mild, moderate, or severe according to the differences in the uptake score. And then also looking at the difference between the scintigraphies before ablation and then after ablation. In principle, the worsening of the uptake score was observed in 182 of the 852 salivary glands, which is quite significant. So 20% of the salivary glands were dysfunctional on this scanning 5 years after a single ablation. And most of these ablations were 150 millicuries. So while the parotid glands, those glands that are by your ears here, are more susceptible to iodine 131 related damage because of its anatomy, and the secretion of the parotid gland is more watery, the xerostomia was associated with those parotid glands being damaged for several years after the ablation. And then the submandibular glands, that which would be under each side of your lower jaw, the prevalence of also the glandular damage in those major glands were found to be true as well. So the occurrence of xerostomia held true in this much larger trial than the one that we did about 15 years prior to this most important contribution. And really the bottom line is that even as you are finishing the ablation and then move from the procedure to then your healing and then on into long-term healing, what is found many times is based on the concentration, the amount in millicuries of the radioactive iodine, you will see damage that can last for a very long time, if not indefinitely. And the actual not only concentration and its volume, but its constituency, that which is the ingredients, let's call it, of the salivary composition can be markedly changed. So we definitely see from normal scans that which would be before the salivary gland impact from iodine 131 to that which is even up to 2+ years thereafter, there can be abnormality that occurs in the anatomical functioning from the gland to its orifice of how it secretes into the mouth. And you can get strictures into these ducts that cause substantial changes, as well as backup of salivary gland production, and hence swelling and hence discomfort. We did multiple trials since our early days in our interest of salivary gland dysfunction. And principally what we have found is whether there is salivary gland impact from iodine 131 or whether it be through external beam radiation treatment, the composition of the saliva markedly changes. Its molecular composition markedly is impacted. We published in the 2000s of multiple series of studies that was actually looking at the not only composition of the saliva, but also with regards to what happens with quality of life of an individual who goes through the suffering of a drying impact. So again, repeatedly, whether it been, again, is an external approach, whether it be external beam treatment followed by thyroidectomy, and or with regards to radioactive iodine at higher concentrations, long-term impact is certainly present. And again, as I said earlier, there is a crossover of so many solid tumors in addition to not only thyroid disease, but other changes that occur in the oral cavity from having a treatment of other diseases, such as disease of the tongue, as disease of the floor of mouth, diseases of the salivary glands. When a major salivary gland is markedly impacted by a cancer treatment, it can have long-term consequences that can certainly change an individual's taste, protection against cavity formation, periodontal disease, gingival integrity, etc. So moving to management and how one would go about with considering an approach is really dependent on having an understanding of what has the individual received and what has the individual had as far as damage specifically to the glands. So a starting point for us is that we know that even before an impact of cancer treatment, that saliva is more than water. It is a complex bodily fluid that contains proteins and enzymes and molecules and electrolytes, and that which can help early digestion. And when there is an upset in the balance of such salivary composition, a change in the integrity of the mouth can be absolutely impacted. So, as an individual increases in dryness, so does traditionally harmful bacteria. And this laundry list is through great number of research funded projects over the years that have shown the changes in the oral microbiome and what happens with the oral cavity when dryness occurs. And so the bottom line is that we see an increase in harmful bacteria and a decrease of that which we consider beneficial bacteria, particularly that bacteria that helps with balancing and initiating our overall digestion. So the impact that can occur with a higher propensity of increased microflora that is on the harmful side can change the individual's nutrition status and higher incidence of tooth breakdown, and then gingival inflammation and more painful gums, as well as all of that which would go alongside it with having prostheses that don't fit well, to having oral pain, and to have also this burning mouth that is very difficult to change. So the salivary microbiome has been what I have put a great deal of effort in our laboratory in assessing what is in the composition of saliva and how it has changed over the years and what is its downstream impact in all of our lives when we have an upset as to the composition of the saliva. And so there are a great number of studies that have shown even when there is a change in the oral microbiome, it could even have a risk of recurrence to an individual, or a propensity of developing a squamous cell carcinoma when there is marked changes in the microbiome, particularly in the digestive tract, and when an individual has substantial challenges with reflux disease and esophagitis or a Barrett's esophagitis. This can markedly impact the overall consequences of having a higher risk of developing a second cancer or a new one. So additionally, the microbiome has been shown to have links to hyperthyroid disorders. And it is extremely important that the immune system is not overwhelmed by bacterial invasion. So having a balance, what we're going to call an ecosystem, and having the gut microbiota, having it in a more healthy state can have such consequences of benefit or of demise. And so the microbiome research community has been investing great effort and dollars into having a better understanding of that which we consider to be health promoting commensal microbes, and what happens when there's an overtake of that which is on the opposite side, and that would be pathogenic bacteria. So you don't have symbiosis, you have dysbiosis, and that can certainly cause changes in the overall outcome. So with dry mouth, we of course see, again, this is a crossover to many of the diseases of the head and neck when the impact of therapy will change salivary composition, is with oral discomfort and pain and fissuring of the oral tongue, is what you see in one of these photographs, and having also a change with regards to leukoplakia, whitish appearing plaques that occur on the borders of the oral tongue, having more difficulty on swallowing and altered taste and an overall nutritional demise, and having weight loss and having loss of appetite and having less of a quality of life because of what happens with then the side effects of much of the therapies that we are providing. So, in the saliva top 10 list of why each of us needs saliva and competency in saliva, the short of this is that we need to have competent saliva to have good early digestion, having good taste acuity, to be able to have lubrication for good swallowing and early digestion, as well as for speech. Having also the ability to have antiviral and antibacterial and antifungal capacity with competent saliva. We're so blessed to have a saliva that is, for us though, that have competency in the saliva of being able to eradicate various viruses, even in the oral cavity and the oral pharynx. So the cleansing aspects of saliva is paramount. It also protects and it helps to reduce inflammation, and it has a reparative function. It also provides, saliva provides teeth to be remineralized. So even with an individual who has early onset of a cavity that develops in a oral cavity with more competent salivary function, you could see a reversal and an arrest of that cavity formation. So in addition, it also is that saliva can help through a lavage impact to reduce plaque in calculus. That is a great harbor for certain harmful bacteria. And then lastly, again, something so important to many of us, and many of us forget it until we lose it, and that is buffering capacity. To have the equilibration when we have a very acidic food item, or a diet that has had more soft drinks and more acidity and effervescence, and having the pH change can markedly impact the overall changes in our gut flora, and also with regards to having more reflux disease when we have a dysfunction in the salivary output. So management of xerostomia in our service has been looking at that which is easier to do and more grassroots and less invasive, such as eliminating alcohol and phenol containing mouthwashes, to increase oral moisturizing for those patients suffering with xerostomia, to use sugar-free and xylitol containing mouth products. When we have to step up, that the more, let's call it a grassroots approach to treating a xerostomia state does not benefit a patient, we'll then start moving into non-pharmacologic methods. And if it doesn't work, then we step up to pharmacologics. So locally applied non-pharmacologic impact would be something like an increase of having water products that may have aloe vera in it, cryotherapy, having more ice used in certain times during the day to stimulate salivary output, sugar-free lozenges, xylitol containing chewing products. Also a non-pharmacologic method that we've had great success and have just published a large series with our colleagues in China has been with acupuncture, and using a technique called the 13 points of Nipchow. So acupuncture is also extremely beneficial, and it has a varying impact on a number of patients. Then as we step up and we go then to pharmacotherapeutics, there are artificial salivas that can be used and prescribed. There are many on the market, some with calcium, some with phosphate, some combined, some with ace mannan, which is the active ingredient in aloe vera, and others. Some of the vitamin waters and some of the antioxidants could be of benefit. And then we step up to pharmacotherapeutics, and there are a great number of those that are either ingested or are are going to be infused. And there are medicines that are within a family called cholinergic agonists that are FDA approved to stimulate salivary function, such as pilocarpine or cevimeline or bethanechol. And these are agents that can greatly benefit some individuals at varying levels. We have found that combination of some of these approaches may be of benefit, such as also introducing tocopherol, which is vitamin E, and lemon juice and candy, particularly prior to the actual infusion of iodine 131 in its ablation. Having chewing gum used or thyme honey, and a protocol that was introduced about 10 years ago called the Cincinnati regimen, which was prior to the iodine 131 injection. An individual would have dexamethasone and dolasteron administered over 5 various doses over a 2-day period that could increase overall salivary output that normally would be damaged, particularly when it's more than 150 millicuries. So these are some of the ideas that we would go about, hoping that that we can salvage salivary gland tissue as greatly as possible through the way that we go about with planning not only for if iodine 131 is to be used, or the planning with regards to external beam radiation treatment, in having our plans eliminate the bulk of treatment over the major salivary glands and reducing the amount of radiation to those regions, but not sacrificing tumor control. Same thing with iodine 131, of introducing certain approaches prior to the start of the infusion. So some tips for relieving dry mouth and the dryness impact would be to use more sugarless drinks and to reduce sucrose. And ice chips have been such a salivary stimulant. To avoid irritants such as alcohol, tobacco, and high concentrations of caffeine. Chew sugar-free gum, or to use sugar-free candies with xylitol. To avoid salty, spicy foods, particularly soy products that can make your mouth so dry. Some individuals need to have humidification at nighttime, and others are going to need the benefit of salivary substitutes that are over the counter. Our goal setting within our oral oncology service is for most patients who are going to have a compromise of salivary function to eliminate alcohol and phenol containing mouth products, and then move in the direction of alkalinization with sodium bicarbonate, good old-fashioned baking soda and water rinses. And we've published this, and we've shown such benefit of alkalinizing the oral cavity and reducing harmful bacteria. Our goal setting is to optimize oral care, to use the American Dental Association guidelines in having your mouth moisturized, and to have you brush your teeth morning and at night, and to use a soft bristled brush that is not harmful to the gingival tissue, and to use a dentifrice, a toothpaste that is kind to the teeth, kind to the mouth, and has a overall less pungent or too much fragrance or too much of a flavoring agent that could actually burn tissue. The other adjunct to this is that some individuals, because of inflammation, are going to need to have chlorhexidines prescribed that can be very beneficial for some individuals in reducing gingival challenges, as well as reducing the contamination of harmful bacteria. Salivary gland substitutes that we coined the term silagogues. There are so many on the market, some that have had a long history, such as the Biotine, the Lacklead Corporation products, and those that I strongly advocate, which is in the center, the Oasis products, which come out of the Whole Foods Group and the Toms of Maine subsidiary. There is a small organization that is out of Florida known as MedActive that also promotes salivary gland products. There is a long history of the product cathosol, which is a calcium and phosphate that is intermixed, and you use 2 vials, one of the calcium and one of the phosphate. And once mixed, then you use it several times daily to stimulate salivary gland function. It does have some reparative also benefits for salivary gland tissue, but also gingival tissue. And then a freeze-dried approach to calcium phosphate benefit therapy, and that is a product that actually comes out of Texas called Saliva Max. Lots of different stimulants that are there on the market that again can benefit. What we hope for is reduced sugar, if not eliminating sugar, and sugar substitutes for benefit. Alternative therapies, again, we've published a great deal from our early days in seeing the benefit of the 13 points of Nipschau to be used by master acupuncturists. And we have just completed a study of over 500 individuals and published in several high-profile journals that showed the benefit of what occurred when you were on active therapy with acupuncture versus those that were on the control arm using sham therapy. And so bottom line was that a great number of those, and statistically significant number, had improvement of their salivary gland comfort and also a ability to have less reflux. Now, silidinitis, which is a common challenge with inflammation of major salivary glands, does occur after iodine 131. It includes pain and swelling of the affected glands. It can enhance trismus, and it can give an individual more of a sour taste or a burning sensation, as well as facial weakness. And patients with xerostomia often will complain of oral discomfort and pain, an increased rate of dental caries and oral infection, as well as more trouble swallowing and taste acuity, and overall a poor nutritional intake. And this is in parallel with those that have higher doses of millicuries of radioactive iodine. So consequentially, it can also reduce overall body weight for some individuals through the influence of much of the other morbidities that I just, these side effects that I just introduced. So silidinitis, particularly post the ablation procedure, can again happen even several months after the introduction of radioactive iodine. It can be found in some individuals even up to several years. And because of the fact that the parotid glands, again, those glands that are closer to the ear, tend to pick up the overall radioactive iodine in addition to the thyroid glands as an exocrine gland, what you find is that that is a gland that is so sensitive. And it's not only sensitive to radioactive iodine, it's also sensitive substantially to external beam radiation treatment. And so tends to be more prone to injury for those parotid glands, and hence more swelling by your ears. And you can certainly see that the higher the millicurie dosage, the higher the damage. And sometimes these patients will require more advanced care. In addition to physical therapy, they may actually have to go through other invasive procedures. And so the mechanism of salivary gland injury from the radioactive iodine occurs via the accumulation of the 131 in the salivary ductal cells. And some of these concentrations can be up to 100 times higher than that in the plasma. So the conservative management is doing a massage therapy of this inflammation, this parotiditis, that can actually occur in those glands that are very vulnerable and very sensitive and easy to challenge, and again, by your ear. And many will find that stimulation can be of benefit. However, these days, in the last 8 years, siladinoscopy has been also reported to be a potential alternative treatment that can be of a benefit for avoiding the need for external surgery and showing that a minimal operative morbidity, or let's say side effect, in silodenitis cases of varying reasons can benefit from having a endoscopy, an actual assessment of the ductal system of the major salivary glands. So I want to introduce you to one of my partners, Dr. Stephen Lai at MD Anderson, who is a head and neck surgeon, a professor in our department. And his one of his areas of expertise is in silodenoscopy procedures. And of course, this has become very popular in many of the comprehensive cancer centers, where you have an individual who has painful glandular activity, and they have swollen glands, and they are assessed and found to have a stricture in their ducts. And what happens is through the silodenoscopy, this is a procedure that is done in the operating room where you will have a dilation of the ductal system. And in that process, you're thoroughly forcing water through the ducts in enlarging the ducts, but also cleaning out tartar, this calculus that actually can develop in very narrowed ductal systems, in order to eventually have more patency and hence a better overall approach to deliver saliva from the gland to the mouth and not have this swelling challenge. In addition to that introduction of the silodenoscopy, you also have steroids that are injected, and then there's a stent that actually is surgically positioned at the end of that, which is the duct going into the oral cavity. Silodenoscopy, it avoids having to have an external scar. It gives more preservation to the gland. It's a same-day surgery. There's fast recovery. There is substantial reduction of any injury to the neural tissue that's around these delicate ducts. And again, whether this be, as the example in this photograph, of doing a dilatation procedure in the submandibular gland, this is the Wharton's duct under the tongue, or whether it is in the parotid gland through the duct called Stenson's duct, this is the approach that you would have with dilating with various size dilators to get to that which will expand this very forgiving ductal system, and to be able to again show patency to the end of that ductal system. As in this example here, this is called the Stenson's duct, which usually lies right against your first molar. So if you put your tongue up against your first molar, and on the cheek side, you feel a little bump there, and that little bump is the entrance into your parotid gland system. So going in and actually removing through this endoscopy approach the tartar, and being able to dilate and inject a steroid for being able to preserve the dilation is very beneficial, and it has been very well received. And a great number of patients benefit, not only for those that have had iodine 131, but also for those that have had external beam treatment. And this is showing what the stent would look like once it is placed to help with the orifice into the oral cavity. So this was put to a study, and principally it showed that in a group of 26 individuals that had the silodenoscopy for the radioactive iodine silodenitis and overall salivary gland dysfunction, that there was a commonality with many of these patients going into the silodenoscopy, and that was discomfort and swelling, in addition, of course, to salivary gland challenges. And what was found in many of these ducts was a strong accumulation of mucus and tartar and the stenosis of varying levels. And then closer to the glands, having this inflammation that also created this stenosis, or this narrowing of the ducts. And the bottom line for this particular trial showed resolution of the majority of the symptoms that patients did have going into the surgical procedure, and a varying benefit. The majority of those that did go through this procedure in this particular study did show benefit. And it even held longitudinally, long term, to have symptomatic relief. So I want to conclude by saying to you that today was principally a presentation to benefit, only to whet the appetite of the benefit of keeping the mouth clean, of keeping the mouth moist, of having a greater impact of being able to control bacteria and microbes in the oral cavity, to have then a better consequence downstream in the gut. And there are a substantial number of patient education tools that are available to you and on many of our websites. And you can not only find them on the websites I'm providing you here on this slide, but also through NIH and NIDCR and ThyCa and through the American Thyroid Association. And I want to thank you for being a part of today's presentation, and also to the planning committee for allowing us to present some of our data and to encourage you to keep your mouth clean.